Today we have a fairly simple question to answer, or so it would seem. Should an adult with a new onset seizure be started on an anti-seizure medication? The challenge is it's really not that straightforward of an answer. I'm hoping today that we can equip you and your loved ones with some information that will allow you to have some shared decision making with your provider whether or not you should be started on a medication. My name is Dr. Kaiser, a board-certified neurologist with Dr. Neuromatters. Let's get into it. The American League Against Epilepsy suggests that anybody that has a 10-year risk of seizure more than 60%, they should be placed on an anti-seizure medication. The challenge, there's not a great way to know what that risk of having a recurrent seizure is. What we do know is that after your first seizure, the chances of having a recurrent seizure is going to be highest in the first 2 years, and those estimates range between 21% to 45%. Now, after somebody has a second seizure, their risk jumps up substantially to around 73% at 3 years. And so it's pretty well agreed upon amongst neurologists that after a second seizure, you should be on a medication. Now, some factors that I think should influence your decision is if you've had a prior traumatic brain injury, a stroke, something that would cause a structural problem with your brain that you would know based on some kind of previous imaging. If that's going to be abnormal, your risk is going to be higher. If you have an abnormal EEG, your risk is going to be higher. And lastly, if you had a seizure that awoke you from sleep, your risk is going to be higher. Now, those shouldn't be the decision makers, but I think they should be considered as you're looking at medications. Now, interestingly, if you do decide to start taking a medication, your risk of having a seizure will be less. You're going to be about 35% less likely to have a seizure at 2 years than if you didn't take that medication at all. But interestingly, if you look at the quality of life of those that took a medication versus those that did not take a medication, they look roughly the same. We would say their quality of life is roughly the same. Now, I think those can be challenging studies to interpret, but when they look at quality of life, they're talking about things like the influence of a seizure on driving, employment, things of that nature. Now, to me, I would take these really seriously. If I'm not able to drive, that's really going to impact my ability to do my job without big interference in my lifestyle. And so I think that's something to take into consideration and, again, have a conversation with your provider. Also, interestingly, if you're wondering to yourself does starting a medication now influence your long-term risk of having additional seizures? If you look at people that start medications immediately versus those that do not, there's no difference long-term between those two populations and their long-term seizure risk. And so the medication now is not going to help you long-term. Now, should you decide to take a medication, the general adverse reactions that people have is somewhere around 7 to 31%. I know that's a big variation. We'll have some kind of adverse reaction to the medication, but generally it's minor, it's reversible if you stop taking the medication, and so I wouldn't necessarily let that be the thing that stops you. Now, if you found this content helpful, I hope you consider like, subscribe, but I think most importantly, I'd love to hear your comments. What was beneficial? What else would you like to hear more about? And I hope to see you next time. This is Dr. Kaiser with Dr. Neuromatters.